depth to a place that isn't just weird.
It's wonderful, challenging,
and changing.
And evenings here can really move.
Central Texas sports come at you full speed.
Austin's a city in motion.
And it needs an evening newscast
and a forecast
that covers it all at the speed of now. Evenings on KXAN News.
Sorry. I had like all these stuff.
Hello and welcome back to KXAN Plus. I'm your host, Esmeralda Zamora, and this week we have our Simple Health segment with KXAN Simple Health expert, Jose Torres. Jose, thanks for joining me. How are you doing?
Hello, Esme. I'm doing well. How are you?
I'm doing great, too. We're here again with another Simple Health topic, but before we get into it, give me a recap of what Simple Health is.
Well, here at KXAN Simple Health, we try to empower you with information, letting you know about new treatments, resources that are available. You know, sometimes we or maybe someone we know is dealing with a hardship, a medical challenge, a health challenge. And so we try to give you some hope there with the things that are out there. We've talked about new treatments regarding HIV. We've talked about a new way of testing for blood cancer. And so we try to bring that to you again to empower you with information and, again, bring you some hope with all the things here that are happening in Central Texas.
Yes, and some of these topics can be really hard to understand, so it's important that we break them down and make them easier for all of us to understand, and as well as be aware of all the things and the resources out there available to us. This week, St. David's is helping with a groundbreaking study that affects men who had their prostate removed. Tell me about this study, Jose, and why is it so important?
Well, it just started, and luckily we have with us today Dr. Eric Giesler with St. David's, and also we have David Lynch here to tell us more about it, just to let us know about why this is so important and why men should be, men who are experiencing prostate cancer or are dealing with complications after surgery, why they should listen to this story. And again, thank you so much for joining us. Doctor, let's get right to it. What is this study, this groundbreaking study about?
Well, this study is just taking place here in Central Texas at St. David's, and it's really helping men deal with some of the complications from prostate cancer surgery. Prostate cancer, as you may know, is the number 2 cause of cancer in men. 1 in 8 men get it. Early on, it is asymptomatic. That is why we recommend screening starting at age 40 if you have a family history like I do, or at 50 if you have no family history. And it is a cancer that it can greatly change someone's life. However, if caught early, there are really good interventions that could limit not only impact on long-term lifespan, but also quality of life. And David here has been nice enough to join us today, who's really been through it and tell us a little about his journey.
Yes, David, go ahead and tell us your experiences regarding prostate cancer.
Yeah, so I took a blood test and to get a checkup, and they took my PSA, and I didn't even know what that was. I'm 53 years old, 52 at the time, and found out that I had something to do with cancer. Nobody likes to hear that. It was elevated, and so I made an appointment here with Dr. Giesler, and we went through the steps of determining, yes, I did have cancer, and that I need my prostate removed.
And you're not a part of this study, but what are your thoughts regarding this this thing that that St. David's is a part of, that it will eventually help millions of men out there?
Yeah, so I mean, I wanted to be part of that study. Actually, it sounded great to me, but I'm all for it. But wasn't able to because of my situation. Wasn't able to take part. But anything that helps with the early continence is great.
Yeah, one of the biggest side effects of surgery that most men worry about is urinary control or leakage with urinary control. Just like women, as they may age, they may have some urinary leakage with coughing, sneezing, lifting their toddler. And then sometimes that's, can be quite embarrassing and, can limit people. And although we're getting better and better with the surgical technique, it's still a real risk and can impact people in a negative way. And if we can shorten the amount of time that they leak, or if we could minimize the amount they leak as well, that would be a great impact in how people really not only do from an oncological standpoint in cancer cure, but also recovering from a major cancer operation. And that's really what the study is looking at. It's looking at placing a device that will limit the amount of leakage and hopefully the amount of time a man leaks, and really put them back to how they were pre-surgery as soon as possible.
Doctor, can you explain to us how long this study is and how long it took to, or how long it takes a patient to go through the entire thing?
Well, the device is implanted at the time of surgery, and it only takes another 15 minutes. So it's not really changing the experience what the patient goes through during the operation. The study is a 3-year trial where they'll be following persons for 3 years, and they'll generally just be doing questionnaires. The person's initially blinded, meaning they don't know if they have it or not. The physician obviously does, will be placing it. Now, the neat thing of this thing completely dissolves within several months. So it is nothing permanent left in to the body. And so what we're hoping to find out is, will it help a man regain urinary control sooner? And also, if they do leak, will it reduce the amount they leak as well, which is very impactful to a patient.
And David, if you can let us know, what were your complications after prostate surgery?
Well, I mean, you're never ready for this kind of thing, right? You think you are, but you're not. And I mean, everything from freaking out that maybe you won't be able to use the bathroom, right? Because you have to have a catheter for about a week or so, and that's an experience that every man hates, right? Who wants to go through that, living with that. And then when that comes out, you don't know what it's going to be like, right? So it's this whole period of, well, am I going to leak like crazy, or is it going to be dry? And some men are dry on the second day after the catheter comes out. Others, they'll never dry, right? So it's a crapshoot. It's a lottery, and you can make progress and then slide back again. And I'm working with a physical therapist for the pelvic floor at Urology Austin, Dr. Marsh, and she's helping me, make this better. Through diet changes plus exercises that you can do, right? So it's phenomenal.
Yeah, and I think that's the key, is having a whole team. It's not only the physician, it's the nursing staff, it's the physical therapists who really help those persons through that journey, and I think really help those patients get back to normal, whatever the new normal is, as quick as possible.
And what are the risk factors for not getting this treated?
Well, the risk factors really are on the aggressiveness of disease. Some people have a more aggressive form of cancer, which requires a more aggressive surgery. When you do more aggressive surgery, you have to take more of the outside tissue, which unfortunately involves some nerves. You could damage some sphincter. In David's case, he had it localized on one side of his prostate, so we were able to be very aggressive on that side. But unfortunately, on the other side, spare a lot of the nerves. So as long as we could spare some of the nerves, he should do well, but it does delay the eventual return to normal. And the number one goal of surgery is to get a person cured of cancer, free of cancer. The number two is to get them dry, where they have control of their urine. And then finally, which we're not talking about here, but sexual function, which is very important. The ability to achieve an erection and maintain an erection.
And regarding this study, how will you be keeping in touch with participants, and what does that look like?
Well, generally it's just questionnaires. They will have some data where they'll have to, if they're leaking, just quantify the weight of the amount of leaking. And it's just a longitudinal study watching how they progressed, and then ultimately the data will show what it shows.
And David, when you what made you go and get tested for prostate cancer?
Well, I was getting older, and I was just curious. I wanted a baseline on testosterone, and I didn't know that as part of that is that they would, like I said, that they would test the PSA as well. And I'd never heard of it before because I guess I'm just not in that age bracket. I hadn't been for a physical for a while, longer than I should have. And so, I had no symptoms, of course. Anytime people say that they have symptoms, I think it's just what got them to the doctor, essentially, to find out that they had the cancer. So you hear everyone believes that they think they have symptoms, and it's really not a symptom. It's almost symptomless in an early stage.
Did doctors catch it early?
Absolutely. Yeah. In my case, like Dr. Giza was saying, it had infiltrated the nerves on the one side, so it made his job tougher, but he's an excellent surgeon, and he patched me up really well.
And I ask these questions, doctor, just because both of you are saying there are no symptoms. So what's your message behind that?
Yeah, I think two things. One, listen to your body, as David said. Sometimes some guys think they have symptoms, and patients know their bodies best. So if you feel something's not right, take it in. I call that the check engine light of life. You see it in your car, you take it in, think it's going to explode, but generally if caught early, it's just a little something we could do. Other times it's not, and that's where the routine maintenance, just like your car, you don't let the check engine light go off for the oil change. You take it in every 3 to 5, 10,000 miles, depending on what you drive. But you should take your body on, especially when you hit the 4th and 5th decade of life. For women, we have to screen earlier now for breast cancer, also for colon cancer, and both men and women, the screening starts at 45. And again, for prostate cancer, we're seeing all cancers move to an early stage. And cancer is really a threefold thing. There's the genetics, what are we predisposed to? 2, time, how long have we been on this great earth? And 3 is what is the environment that we live in and work in? And we don't understand all those things, but we know that it is getting more toxic out there, whether it's being weather patterns, whether it be things we're exposed to in our environment. And so we have to go in and take our body in earlier to be evaluated. And don't be scared of the doctor. I think that's the biggest thing. I hate going to my dentist, and he's my best friend. But he knows that it's not something I enjoy doing, but I go anyway. And I think that's really the thing. It's like sometimes we have to do things we don't really enjoy doing, but if we do it, we'll stay ahead of the curve. And I think David, he was feeling that point, like he said, hey, I just want to know my body a little better. Unfortunately, and they did a great job.
Yeah, and I don't know if, I'm sorry, Yasmin.
No, you're good.
I don't know if many men know that all it requires is just a simple blood test. Because when I went to get my blood test a couple of years ago, just to rule that out, it surprised me that that's how easy it is now.
Yeah. And I think the other thing, and David, maybe you could expound on, there's support out there for individuals, and you're not alone. And, maybe you could talk a little about that.
Yeah, so I'm part of a local support group here in Austin, and it helped me tremendously when I was first diagnosed because I didn't know what was going on. I was freaked out. Who wants to hear the word cancer, right? And those guys helped me by sharing their stories and supporting me. And so I've been continuing on with that group, and we meet in South Austin first Tuesday of every month, and we'd love to have people who want to learn more about prostate cancer, who need support, caregivers, and patients. I'm also on Reddit. We have a great prostate cancer group on Reddit. I hear from lots of men who are going through these things, and I'm hearing the weird cases, right, because you're getting a lot more people there. But there's support out there. Zero Cancer also has local support groups for all different cities and for online support groups. So yeah, there's lots of support out there.
Yeah, and Jose, I think that's what's so neat about this program. You're highlighting local things, real people, local facilities that are doing really world-class things right here in the heart of Central Texas.
And David, for those patients that are somewhat afraid or timid to go get that first screening, what is something that you would share with them throughout your experience that you learned?
Well, I mean, you got to open the email or go back. You get that call, right? We want to talk to you about your PSA results. That's not good. I have to go in and right. So it's better to know it than not know it, especially with prostate cancer, right? Where there's options, there's time, right? If you catch it early, even if you catch it late, there's a lot of treatments, unlike other cancers. So don't hide from this, right? Get in front of it. You've got a better chance at a long life if you can get it while it's early.
Something we didn't touch on is that St. David's, I believe, is one of 10 testings, or one of 10 that are taking part of this study. How was St. David's tapped into this?
Well, we actually have Urology Austin. We have a big research component to our practice, not only in prostate cancer, bladder cancer, overactive bladder, several non-cancerous disease states that are in urology. And some of these project studies require interventions or surgeries, and we've partnered with St. David's here locally to be able to perform those in a research setting. And so they've been great partners with Urology Austin and allow us to really be part of some amazing studies. We have an international trial as well with another prostate cancer therapy we're doing. So it's really putting us at the forefront of therapies to bring to our patients. As a physician, it's amazing. I am so lucky that I have other partners as well that we can bring really state-of-the-art care to our patients here locally.
Doctor, is there any cap in the amount of patients that can enter this study that you all have, or is it open to everyone?
It is open. Ultimately, there will be a cap to the entire study. Off the top of my head, I forget what that is, but we're far from it. And I think it's an option for all patients who are going through this disease, who have unfortunately found to have prostate cancer, who need surgery. It is a potential option for them.
Regarding surgery, so say you tell a patient, all right, this is what we found, it is prostate cancer. What are the immediate steps after that?
Well, I think
Freak
first,
out.
right, it depends who you're talking to. Unfortunately, that individual and their families are going to have that moment of freak out, which is very normal. You're telling me I have cancer and I feel great. Two, you're now in a club they didn't ask to be in, and like you said, there's a great wealth of knowledge among men who've been through this journey. And three, I think from a physician standpoint, it's really getting those patients all the information they need to really understand their disease state and really to take control. I think when we hear that C word, as David alluded to earlier, it's a mortality check. It's scary. We take a very defensive position. We let the cancer dictate our actions. Fortunately, when we screen and catch it early, we get to be the offensive. We get to be the Peyton Manning of the cancer. We could dictate what happens to that cancer. And then also putting them in front of the right people. I'm a surgeon, but there are other treatment options. Radiation oncology is one. Other certain novel therapies are others. So making sure we get all those patients in front of the right people to hear it from the experts to really understand their disease state so they can really come to a informed decision. And ultimately, I truly believe that if we do our job right, the patient knows what's best for them. They know their body better than anyone. And that's what I really encourage all my patients to do, is really figure out what feels right to them.
And David, regarding the support group, I'm a big believer that community keeps the heart beating. Tell us about the support group. You don't have to go there and talk right away. You can just sit there and listen, or how does it work?
Well, I mean, it's people like you, right? You're part of an unfortunate club. No one wanted to join it, but we're in it. And so we're the guys that can help each other the most. And there's guys there who've been through it. There's one guy there who's been there 20 years, post Gleason 10, the highest score there is, right? And so you don't feel like you got the worst case, maybe, right? Because there's people there that had it worse than you, and they're doing great. So just that alone, right? Just to know there's other people going through what you're going through, and you can ask them questions, right? When I had my surgery, I had several men I could talk to about what's it like. Am I going to wake up with this robot half embedded in my abdomen? Like, all my fears, I can have someone to talk to about these things, right? Because it's surgery, it's a major surgery, and having those people there is what it's all about.
And doctor, what happens after the study? What's the next? Or what does the process look like after at the end of the 3 years?
Well, the next step would be submitting it to the FDA for approval. If it does show a benefit to the patient and no increased harm or risk to the patient, then it would be an approval process to be approved here in the United States, which then it could be placed in any gentleman anywhere undergoing this surgery. And again, to help mitigate the amount and the length of time that a man will have urinary leakage after surgery.
And is this this treatment taking place anywhere else, any other countries other than the United States?
The first one I did, it was done in Panama City. We did that there. But currently, this is a U.S. trial, so it's currently being done across the United States.
Interesting.
Well, before we wrap up, any last thoughts, anything you want to get across that maybe we didn't ask, you think it's important for people who are watching this to know about?
David, what do you?
Well, I mean, with the PSA, it's a screening tool, right? A lot of people on Reddit are freaking out when they get a high PSA, and especially young guys. We see a lot of young guys on there that's like they're in their 20s. And the first thing you need to go is just go to your doctor, right? You're coming to a discussion forum. We're not doctors, right? So go to your doctor and get his opinion, because there's a lot of reasons that the PSA can be elevated. I had chronic prostatitis and I didn't even know it. It was in the MRI. So that kind of thing can elevate your PSA. And so you need to get a real doctor, right, to look at this and take several PSA readings, because it can be elevated, right? So don't think that just because you have an elevated PSA that's the end of it, right? There's plenty of hope, right, that you don't have cancer. And so again, go get the test, right? It's the best thing is my message.
Doctor, any final thoughts?
Yeah, I think just, be proactive, take control of your body. Around Austin, one of my favorite things to see the gentleman who does the graphic art to live a great story. This is your story. Every chapter is different. David's just gone through a chapter. I think we all go through chapters. But, always turn the next page, be hopeful. And again, be the curator of your story. And I think if you do that, going to the doctor, listening to your body, it will be an amazing book.
Well, thank you so much for joining us here in the studio and taking time out of your day to come and have these important talks that everyone needs to hear, especially from real people and real doctors. Thank you for being here. This article will be on our website, kxan.com, and anyone interested can go to the website, to the homepage, and find more information on this topic. Jose, thanks so much for joining me. Anything you want to say before we go?
Totally off topic. I just have to give you a little hard time and hold you accountable to your running. How's your running going?
It's going great. I actually did 3 miles yesterday.
Oh, nice.
Not all running, walking and running, but I did 3.
Look at you, consistency.
I'm going there little by little. I'm getting more active.
All right.
Well, thank you for joining me, Jose, and we will see you next week.